On the northwest side of Tucson, Arizona, with a dramatic backdrop of the Catalina Mountains, Dr. Judy Huch has established a thriving and trusted audiology practice in a luxurious state-of-the-art facility.
Oro Valley was just originally down the street 2 miles. It was in the perfect location because it was in the middle of Sun City. That's a 55 and older community and a very active community.
Hello. Hi, Judy.
I have 3 front office people. The 2 that you will encounter at Oro Valley are Peggy and Barbara.
You got it.
I keep telling people nothing's smaller than their elbow, and that I'm the only one that should put anything small down into their ear canal. It's helped me become a very good mother. Do as I say, not as I do. I'm different because, one, I'm a doctor of audiology. I encompass the entire hearing system, and I keep that as a vision for each individual patient throughout the entire time that they are my patient. Even though I'm young, I've been dispensing since 1991, and so I have many years of experience behind me. Also, with that experience is longevity, and places who deal with hearing aids come and go. Any specialty, if you're looking at something, you want to go somewhere where they're going to be around. And seeing my patients from 1995 on, there's many that I have had since 1995. I work extremely hard to make sure I have the right fit for that particular patient. If you deal with one company, you are doing your patient a huge disservice because one company cannot do it.
Dr. Huch has established herself as one of Tucson's premier audiologists and has a second office on the east side of Tucson.
Sometimes people will come in that they just have a plugged sensation in their ear, or they have said, I took a shower and I get water in my canal and now I'm not able to hear, or I used a Q-tip and now I can't hear. And so the initial is just using an otoscope and determining on whether or not there's earwax, or if they've pushed it beyond into the bony portion of the canal, because then the ear can't push it out itself. People with hearing aids also, one of the symptoms that they'll have is feedback, that all of a sudden their hearing aid will just be squealing, and there is no rhyme or reason in their mind for it, and they'll come in and I'll just see a wall of wax in their ear canal, and so once I remove it, they don't have the feedback because the sound just bounces right off that wax. And many of them don't believe me until I take the wax out, and then they'll, I don't have feedback anymore.
Dr. Huch is the first in town to offer an exciting new hearing aid solution called extended wear.
The extended wear is completely invisible. It has an extended battery, and every 2 to 4 months I change it out. It has been very good for the people who have decided that is the option for them.
For me, it can be bad across the room. In particular, even with these on, if my wife has a habit of just starting to talk, and I may have my attention a mile away when she starts, and so I end up having to ask her to repeat. And she gets really sick and tired of that. She doesn't like having to do that at all. She has probably as good a hearing as you can have. And she'd hear a pin drop from the next room. Singing is a hobby of mine. And except for the loss of voice control that's come with age and so forth. In fact, I would say it's about the same. Because I hear well enough to make the chords, so as long as I can do that, I'm okay. The music plays.
Okay, that's better. Would I do it without it? Absolutely. But it sure is nice when people do an atta girl. It really is. You need to come back every day and tell me that. It helps you get through the day when you have those other frustrations. People do. They cry in the office because they are so happy that they could hear, and they never dreamed that this whole experience could be pleasant. You want to be humble on one side, but I know I'm good at what I do. Because it's also in my core beliefs, just as a person, that we are called to help people.
ready for you now.
Dr. Judy's really personable, easy to talk to. When Judy asked me what color would you like, I said purple. I would love to, next season at the symphony, I'd love to be able to hear a symphony orchestra the way I used to.
The care doesn't stop with the fitting of the device. The care continues through the entire relationship, the entire journey, because that's also how I think of my interactions with my patients. I am taking a journey with them to help them hear and communicate better.